Hi, my name is John Kelly. I'm the publisher of the Orlando Medical News. Joining me today is Larry Jones, the Executive Director of the IPN Network in Orlando, Florida, and his Director of Network Development, April Peterson. This is a discussion of how the Integrated Independent Physicians Network can protect their physicians from the coronavirus pandemic.
Thank you, John. I want to just spend a few minutes discussing with our IPA docs in the Integrated Independent Physician Network just some things to consider regarding protecting their practice. And, the first one obviously is personal protection equipment, PPE supplies. We're getting so many calls from our physicians indicating they can't get masks, they can't get gloves, and they can't get hand sanitizer. And our suggestion to that is most of our docs have one supplier that they order from on a regular basis. So what they need to do is order from multiple suppliers, place many orders, and certainly one of those orders are going to slip through. But if they just stick with their one supplier, there's a big chance they're going to be on back order for a long time. The second one is utilizing telehealth to communicate with their regular patients to maintain and manage their chronic patients, prescription refills, etc. And also, this will maintain consistent office practice revenue, as most payers are allowing same level reimbursement on E&M code billing for telehealth visits, and many of them are even waiving the copays. We sent out telehealth guidelines for most payers, as well as an interpretation of the Surgeon General's order on using telehealth services. So all of our docs have that, and please refer to those newsletters that have also been sent out by John in the Orlando Medical News. Another suggestion is many of our offices have actually set up drive-through parking in their lots to take care of low-level patient visits, meaning prescription refills, etc. Great idea versus having these patients come inside and potentially be infected or exposed to sicker patients. And another issue that has come up from a number of our doctors is hospitals are asking for volunteers during this emergency time period. And I've asked, well, what do you think about that? And my only comment there is, remember, this is a volunteer program, but the big thing that our physicians need to be aware of is their specialty malpractice coverage and the boundaries that they're limited to when it comes to malpractice. This is very important. You don't want to be out there doing things that you're not covered under your malpractice agreement. And many physicians have also asked about advice on personal protection assurances from the hospitals that are requesting these additional services and help. And, our suggestion is have that discussion with the powers to be in the hospitals if you, in fact, choose to help during this time. Another thing that you could do is email. And I know that many of our practices either have a phone number, many of them mobile, or an email for their entire patient base. And you might want to send out an email or a text to your entire patient base announcing the waiving of copays and assuring them that your practice is open and accepting patients. And again, ask your patients to call not only before they come to your office, but before they go to the ER or the hospital. This is very important. This will save them tremendous time and money and avoid additional exposure for them in the hospital setting. IPN has requested from most of the payers that they eliminate copays for patients seeing our independent PCPs and specialists that participate in all of our value-based programs. This will incentivize patients to call their PCPs versus just going to the ER or showing up at the hospital. And we've spent a number of years now moving from fee-for-service to fee-for-value. And it would be a shame to erode or collapse all the progress we've made on cost containment and quality under our value-based programs. And unfortunately, subliminally, I believe that the media has made people believe, I don't think they intended to do this, but I think they've made people believe that the only care you can get right now is go to a hospital because they're the only ones that have personal protection equipment. And that's not the case at all. We have reached out to many suppliers, and we want to make sure that you stay within your own PCP, that you get the care you need. And I can assure you, you need to let your patients know that you're there for them in a number of different ways. And the other thing that you need to be very cautious of is maintaining contact with your hospitalist representative for your patient admissions and discharges. Very important during this time that you maintain a coordination of care with these hospitalists. And if you don't currently have a hospitalist assigned for your patients, you need to choose one. And you can call the IPN office if you have questions on that. And also, if you have questions on any of these things that we're suggesting and asking you to consider, you can always call the IPN office. April, did you have anything you wanted to add to this?
Well, I'm pretty sure you were very good in all that coverage. I would just maybe want to mention that IPN or IP Network is really working at the ground level to support all of our practices, whether primary care or specialists, as they continue to see chronic care patients as well. And so we are here to answer any questions, to provide any support, or anything we can do to help them during this time.
Perfect, April. And I think in closing, we want to do everything we can to help you, and we want you and your staff to be safe and well and protect your practice during this corona pandemic time. It will pass. No one knows when, but it will pass. Take care, be safe, and if you need us, call us. Thank you.